Here we are going to talk about the Alzheimer disease. Alzheimer disease is an irreversible form of senile dementia from a nerve cell deterioration. So Alzheimer, a progressive disease that is destroyed the memory and other important function. So in this picture, we can see this is the healthy brain, but it is the mild Alzheimer disease and this is the severe Alzheimer disease. Because the brain tissue gets sink or destroy the memory and other important mental function. And brain cell connection and the cell themselves degenerate and die, and eventually destroying the memory and other important function. So they said long and short-term memory loss occur with impairment of judgment, abstract thinking, problem-solving abilities, and also behavior problem. It is most common in Alzheimer. So dementia is most important sign of Alzheimer disease. As I told you, dementia means a group of thinking and social symptoms that is interfere with daily function. So individuals with Alzheimer disease experience the cognitive deteriorate and progressive loss of ability to carry out activities of daily living. The client experiences steady decline in physical and mental functioning and usually requiring long-term care facilities placement in the final stage of disease. So Alzheimer disease, we categorized stage 1, stage 2, stage 3. So before to go in staging, I want to recap one more time. Alzheimer is a gradual, irreversible dementia resulting in the memory problem, judgment problem, or change in personalities. So the most common risk factor, older age, positive family history, and cardiovascular disease. So in case of the stage and major character of Alzheimer, stage 1 is mild, forgetfulness, most common sign. So stage 1 is mild forgetfulness or short-term memory loss or mild cognitive impairment. And stage 2, what is moderate disorientation, hesitation, assistance with daily living activities impaired, or they need the help in their daily living activities. Also, incontinence or wandering is most common. In stage 3, moderate to severe. So ambulatory dementia is common, and stage 4, late or end stage. So stage 3, a patient have a verbal problem or motor skill lost, and also develop dysphagia, difficulty of deglutition or swallowing. Also in stage 4, increase the hesitation or aggression in the evening time. And this is called sundowning syndrome. So now here, Alzheimer disease, few feature. Agnosia means failure to recognize or identify familiar objects. Dementia means loss of memory caused by brain degeneration. Aphasia means language disturbance in understanding and expression spoken word. And aphasia means inability to perform motor activity and despite the intake motor function. Now, what are the nursing intervention? So, before to go nursing intervention, I want to share about the few words about the treatment. Alzheimer, no cure exists, but medication and management strategies may temporarily improve the symptom. And nursing intervention is super important because of this kind of problem. But treatment, basically we use doneprazil. Doneprazil medication to manage the symptom like antipsychotic, antidepressant, also anxiolytic medication can work. So they said nursing intervention identify and reinforce the retained skill, provide continuity of care, orient the client to the environment, and also furnish the environment with familiar possessions. Acknowledge the client feelings or help the client and family member manage the memory deficit and behavioral change. We encourage the family member to express the feelings and provide the caregiver support, identify the resource and support group, monitor activities of daily living, and also remind the client how to perform self-care activities and help the client to maintain independence and provide the client with a constant routine. So, nursing management of people with Alzheimer's disease is very important. As a healthcare provider, we always try to maintain the patient safety or reducing the stress and anxiety and agitation, improving communication or promoting independence in a self-care activities. We're providing for the patient need for socializations or self-esteem and intimacy. Also maintain adequate nutrition, maintain sleep pattern disturbance, or supporting and educating the family caregiver. What else? We provide exercise such as walking with a escort, avoid activity that tax to the memory, allow the client plenty of time to complete a task, or use constant encouragement in a simple step-by-step approach. Provide activities that is distract and occupy time such as listening music, coloring, and watching TV. Providing the client with a mental stimulation with a simple game or activities. So next go wandering. So maintaining structure environment is important for them, or provide short direction or repetition is important. Frequent orientation, avoid overstimulation or use of single day calendar or maintain routine toileting schedule is important. So what is the wandering? Provide a safe environment, I said. Maintain structural environment and provide unsafe wandering or provide close supervision, close or secure door, and use identification bracelet and also electronic surveillance. So identification, it is very important. So patients should carry the personal identification at all times, and including name, address, phone number, or statement of medical condition and how to contact a family member. Also, we inform the family about the dementia and experienced downward course to the illness. Provide support for planning, long-term care, and health care direction. Also, administer prescribed medication. As I told you, doneprazil is important. Sometimes NCLEX would ask, what is sundown syndrome? As I told you, at the evening time, patient increase the agitation or aggression in the evening. It is called sundown, characterized by a pronounced increase in symptom and problem behavior in the evening, particularly increased agitation or aggression. Provide a safe environment is a priority. The care of the client with Alzheimer's disease. Another problem, this group is called communication disorder. So disorder include language disorder, expression disorder, speech sound disorder is called phonological disorder, childhood onset fluency disorder, or social communication disorder, impaired social communication. So communication disorder, we should adopt the communication level of the client, use a firm volume, low pitch voice to communicate. NCLEX board likes this question. Also stand directly in front of the client and maintain eye-to-eye contact. Call the client by name and identify self and wait for response. It is the way of communication with the patient. And use a claim and reassurance voice. Use a gesture if the client is unable to understand spoken word. Speak slowly and clearly and using short word, simple sentence, so patient easily get you. And it would be easy for you to transfer the information to the patient. So ask only one question at the time at a time and give one direction at a time. So this is the therapeutic way of communication with the patient with Alzheimer. Also repeat the question if necessary. What else? What are the other problems? They have an impaired judgment. So remove the red or toxic substance and dangerous electrical appliance from environment. So home safety is the most important. We have to remove the scatter rug or install the door lock. So out of the sight or patient reach. Also good lighting, especially over the stair, or make the step S with a color tab. Also remove the any kind of cutter substance. So call what altered thought process. Call the client by name, orient the client frequently, use familiar object in the room, place the calendar and clock in the visible place, maintain familiar routine, allow the client to or make the task sample, allow the time of the client to complete the task, or provide positive reinforcement for positive behavior. What else? Alter sleep pattern. Allow the client to wander in a safe place until she or he becomes tired, or provide shadow in the room, avoid the use of hypnotics because they use confusion and aggravate the sundown effect. In the evening time, the patient increase the agitation. So little bit talk about the agitation. We assess the precipitant of agitation or reassurance the client, remove the items that can be hazard, and during the time of agitation, approach the client slowly and calmly from the front, and also speak, gesture, and remove slowly. Remove the client to a less stressful environment or decrease excessive stimuli. Also use the touch gently and do not argue with your client. Before to finish, little bit uh, summary here. Alzheimer's disease, I said, is a gradual, irreversible dementia resulting in memory problem, judgment issue, and change in personality. The risk factor: older age, family history positive, cardiovascular disease, and most common symptom: forgetfulness, short-term memory loss, mild cognitive impairment. And stage 2, disorientation, agitation, or assistance with daily living necessary, incontinence, and wandering. Very late stage, we see verbal problem, motor skill lost, and dysphagia. Let me read it. Confusion with time and location, difficulty of completing familiar tasks, daily living activities problem, or misplacing the items, difficulty of solving problem, memory loss, poor judgment, and unfounding emotion, withdraw from social activity, and also trouble with the image and space. Also difficult with what? Language problem, right?